Tonight's edition of Shark Tank will be featuring two social workers looking to fund integrative healthcare. They are Jasmine Collins and also Crystal Williams. They'll be listening to a pitch by LaDonna Kennedy. LaDonna is looking to fund an integrative healthcare program at the Neighborhood Place in Fairdale, Kentucky. Good evening, Sharks. Thank you so much for having me here tonight. I'd like to start off by saying thank you so much, Jasmine and Crystal, for listening to this and for the contributions that you make to social work. I'm really hoping to walk out of here tonight with another one of those contributions. A contribution to go to integrative behavioral healthcare. What integrative behavioral healthcare is a well-rounded program for people who need to get all of their service in a one-stop location. So we're going to talk a little bit more about that. Let's talk about what integrative healthcare is. Integrative healthcare is your one-stop for both physical care and mental health care, along with any types of referrals that you might need. It's a wonderful program that has proven to increase client satisfaction and to decrease cost in the long run. Do you hear that, Sharks? I'm going to save you some money. Let's talk a little bit about where I think that this great program should exist. I think it should exist in Fairdale, Kentucky. Fairdale, Kentucky is a small rural community at the far end of Jefferson County. They have about 10,000 people that live there. Most of them ride back and forth to work all day to Louisville, and they're just a wonderful community. The problem is, because they are so far out, they do not have the assets that you and I might have in our communities. Let's take a look at the asset map so I can tell you a little bit more about that. Let's take a look at the Fairdale asset map. What you see here is a lot of green. Green represents things like small restaurants, convenience stores, Kroger, Walmart. They're doing pretty good here. Unfortunately, there's only one Kroger in the entire area. They could use more of that. One of the things you don't see a lot of are healthcare centers. There is one Kentucky One Health Center, and there's also health care provided at the Neighborhood Service Center. With the exception of those two, there isn't anything else. The one red dot that you see represents mental health. There's one mental health care provider in the entire area. That's why it's so important to provide a behavioral specialist in this community. So as you can see from our review of the asset map, they do have a lot going for them, but they also do have some deficits. One of the things that's really hard to see on this asset map are the people that live in Fairdale. The people that live in Fairdale are very passionate about their community, and they are willing to do whatever it takes. So I think that taking and placing a behavioral mental health specialist within the neighborhood service center that already exists is certainly a win-win. One of the other things I want to talk to you about is what puts Fairdale at risk. Why is it so important that we have a neighborhood service center with these great programs there? Well, unfortunately, Fairdale has seen an increase in rates of cancer, an increase in their rate of heart disease, unfortunately, an increase in their HIV infections, and also an increase in substance abuse. All of these programs, while working with a well-rounded program, can certainly help to better this community. Here are just a few of the risk factors that Fairdale faces, along with what integrated healthcare can do for Fairdale. Please consider funding this necessary program. So what do I need from you, Sharks? I need $100,000. And the reason I need that is to get this program going. The way I see it, we'll spend about $86,000 for salaries. Those two salaries will incorporate both a full-time licensed clinical social worker and a part-time HIV specialist, so that we can work with those communities in what they need the most, those mental health referrals, and to decrease the amount of new infections and to manage the current infections of HIV in the community. So $86,000 would go towards salaries. The rest of that breakdown will be about $5,000 to go towards outreach programs, because we need the community to know that we exist and we are there to support them. We need to get in and start talking to teenagers about what it means to get infected with HIV, that this is not a curable disease at this point. We need to provide that outreach for all sorts of reasons. So another $3,000 will go towards mileage reimbursement. And that is because our licensed clinical social workers is going to make home visits as needed. If we have somebody who comes to the program that doesn't have transportation, maybe they can't get out and about, our social workers are going to go and meet the clients where they are so that they can better serve those clients. We're also going to allocate about $1,000 for harm reduction kits so that we can start to see a decrease in the amount of HIV infections that's happening in this community that is just so important. $5,000 will go into a family assistance fund so that if we have families that are in dire need, we can have this pool of money to pull from as needed. And this will help to provide assistance to our families. So again, what I'm looking for from you Sharks is $100,000 to support an integrative healthcare center that's going to incorporate behavioral health specialists. We're going to have that full-time licensed clinical social worker. We're going to have that part-time HIV specialist so that we can meet these clients where they are in order to better serve their needs. As I mentioned before, integrated healthcare is proven to work. It is proven to reduce healthcare costs in the long run. Also, with the Affordable Health Care of 2010, this is a fundable expense. This is something that we saw back in 2010 that this will work. So I ask you to please consider funding this program for not only the community of Fairdale, but as Kentucky as a whole. Thank you.